Hello everyone. In this video we are going to discuss about one more histological slide of a tissue. This is adipose tissue. Okay. Adipose tissue is nothing but the fat cells in our body. These are the specialized connective tissue which stores fat. Okay. The cells are known as adipocytes. Okay. How they are? In this slide you are able to see a very white or stainless area with rim of pinkish or eosin stained and a small peripheral place nuclei. This is what the signet ring pattern is known as. So what adipocyte cell contains a fat vacuoles in that one. Okay, fat globules, let's say. So what happens whenever these fat globules or vacuoles expand? Okay, they push the cytoplasm, along with that the nuclei. Hence what happens, the cytoplasm is pushed at the peripheral and the nuclei is also pushed to the peripheral. Hence this gives a typical signet ring appearance of a adipocyte. Here you can see the eosin stained pink color. These are the cell wall, okay, with the rim of cytoplasm, and these are the nuclei which are pushed to the peripheral of the cell, and these are the vessels. Because fat cells or adipocytes, they they act as a reservoir. So hence, to add in or to remove it needs a continuous supply and retrieval system. So for that it is highly vascular, and blood vessels are numerous in this one. These are the blood vessels. So well, again in this adipocyte there are two types of cells. Okay, we can divide them into two. One is yellow fat and the other one is brown fat. Okay, or also known as unilocular and multilocular. The name itself it says. Unilocular means this is the unilocular fat cell. Okay, whereas brown fat is multilocular. What happens in this? This is a cell. Nucleus may be placed central, may be pushed apart. Okay, it will have multiple locules. The fat locules in the brown adipose tissue are multiple, not a single. Hence, there's a difference between the yellow and the brown. And they are named according to their appearance in the living tissue. The brown, they appear brown because of lot of blood vessels in them. Hence, it gives a typical appearance of a brown fat. So, where all this tissue is found? It is found throughout our body, especially subcutaneously. Below the skin, they form a layer of subcutaneous tissue, okay, especially known as superficial fascia throughout the body. Again, this is the distribution of the fat in male and female again varies. In males, it is specifically in the particular regions or regions of the bodies it is there. But whereas in case of female, it is throughoutly present, uniformly thick, uniform layer of fatty tissue is present in females. Hence, it is used. It helps in the thermoregulation. Okay, fat is a bad conductor, obviously it helps in fat. Other than that, it is present between the layers, muscles, between the muscle layer, between the organs. Okay, they help as a shock absorber also. They also cover the organs such as perinephric pad of fat, paranephric pad of fat. Okay, whenever excess of fat is stored, they go and deposit in this various layers of our body. Again, so if you see a slide of a adipose tissue or fatty tissue, if it is a clear as we see here, okay, this pattern of clear is seen because of histological technique where this fat is removed off, and what you see is a whitish appearance with thin or peripherally pushed nuclei in this. So this was about adipose tissue. Thank you.